Hi, my name is Matt Hickey. I'm the Graduate Program Director in the Department of Health and Exercise Science at Colorado State University. And on behalf of my colleagues, I want to welcome you as we take a closer look at our department. Colorado State University is a land-grant institution of about 25,000 students. It's located in Fort Collins, Colorado, a community of approximately 150,000, located about an hour north of Denver. Our Health and Exercise Science department has over 1,000 undergraduate students, but less than 40 total graduate students. This includes about 20 master's candidates and 12 to 15 PhD candidates in any given year. So why don't you come along as we take a closer look at our colleagues and our facilities.
The campus is fantastic. I mean, I didn't even look at any other schools. I came up here. I've just heard such great things about it for anywhere else that I didn't figure I needed to apply anywhere but here.
I think CSU stands out as a great choice for health and exercise science because we have the gamut, everything from looking at cells and tissues all the way to doing epidemiological type studies, applying what we know to health promotion and disease prevention. I think that is important for students to see if they're working at the bench, that they see how their work might eventually be translated, because there's people in the department that are translating some of that research.
One of the nice things about CSU is that students have access to a lot of core facilities and a lot of collaboration opportunities. So investigators across campus, facilities across campus, as well as within our own research in this building that allow them to kind of branch off and get different experiences.
We can really accomplish some high quality science that is on par with some of the best places around the nation. We have some of the top facilities, the top equipment, and some great researchers here.
You really can do a lot of different things here. You have molecular bench level research, and you've got translational epidemiological type research you can do here as well. So when I got done with my undergraduate, I wasn't quite sure exactly what I wanted to do, and I had a lot of choices as to which direction I wanted to take my research and my future studies here.
Some research programs are so large that you get stuck kind of within an individual laboratory and don't really get to interact or collaborate with other investigators. Our program here, there's a lot of opportunity for incoming students not only to learn directly from their mentors, but also to see some of the other work that's going on in our department here.
It's a very hands-on, active research process, shoulder to shoulder with research assistants, with undergraduates, with other graduate students.
It kind of opens your eyes quite a bit as to potential careers, what interests you, what doesn't.
So we're assuming you're here because you have an interest in human health, in chronic disease, in integrative physiology or cell and molecular biology. You might have questions related to how do I affect behavior change that would have an impact on public health. All these questions are being addressed by faculty in this department.
We're trying to answer questions that we feel like can have a nearly immediate impact on people's behavior.
We want people to be excited about what they're studying and be able to feel like this isn't work, this is play, because it's fun, it's interesting, and that's what we want. We want people to kind of develop that sense of curiosity and wonder and be able to take that with them.
Everybody's very, very enthusiastic about their research, excited about their research, but also very willing to collaborate. I think this kind of enthusiasm and excitement for your research and your data is very infectious. So great environment, number one, for the student.
What stands out about this program is the researchers that we have in this department. We work together, we're sort of pushing the boundaries of new and unique techniques, methods. I think that dynamic energy that we have in this department makes it a really good place to be.
There needs to be a balance between finding a program where you can establish yourself or begin to establish yourself as an independent academic scientist, but also finding a program that you have enough close mentoring to really get all of those skills that you need to be a successful academic researcher.
I graduated from the medical school in my country and I came to US and I found the Department of Health and Exercise Science being very interesting in terms of they have all the programs from the level of clinical study to the level of research study.
The broadness and far-reaching aspect of this department is one of its strengths, and that you can find anything that you're interested in here within the department. So there's faculty members that do all sorts of different types of research, and so whatever it is that you're interested in, I'm pretty sure you can find it here.
I can be involved in helping a person to improve their exercise performance, as well as analyze their DNA and their muscle cells to see what is going on, not only at the cellular level, but what's going on as the person as a whole.
Now I'm really starting to bring in people, start doing more blood draws and working with the centrifuges and collecting blood samples and things of that nature. So it's more of a one-on-one approach where I'm actually working with subjects more often, which has been really fun. Well, the professors in this department really treat you almost more like a colleague than they do a student. There's a lot of, they're asking you questions, there's a lot of discussion-based learning going on.
You have access to pretty much any professor within the program. They're either in their labs working with you, or else you can just go upstairs and find them in their office pretty much any time.
I like to get to know my students, because the more I get to know them, the more they get to know me, the more we're going to be able to accomplish and the more they're going to get out of the program.
Working with you to ensure your success both in the classroom and the research setting is obviously one of our key objectives. The vision for the program is much bigger than that, though. We provide students opportunities to get off campus to present their research at local and national meetings. In addition, we have ongoing research and clinical collaborations with cardiologists from the Heart Center of the Rockies and bariatric surgeons from Northern Colorado Surgical Associates, both affiliated with Poudre Valley Health System. We work with many other collaborators in the area, including the University of Colorado Denver School of Medicine. So the opportunities are not limited to the lab or the classroom setting, and that's one of the key features of our program.
We try to have all of our graduate students present data at both local and national meetings. And this is obviously a great opportunity to be there at the cutting edge. What are the latest and greatest findings that people are reporting from their laboratories?
We're required to do a practicum here. That opens up doors. You get to choose where you want to work for. Just gaining professional experience in the real life outside of academia.
Well, it should be obvious by now that the expectations we have for our students are very high. Entry is going to be competitive, and the expectations for continued excellence after your admission are high as well. The good news is that each faculty member in this department holds themselves to high standards. Our desire is to create an environment that fosters excellence.
You have to be self-motivated and you have to be ready to work. I mean, if you do that work, you'll get a lot out of this program because they can really help you out here a lot.
A student who would do well in my lab, and I think in any lab in this department, would be self-motivated for sure, hard-working, most of all inquisitive.
The clinical outcomes for a lot of the research that we do here are pretty important, which is why I thought about coming here.
Students that we're educating today are going to be the people that answer the health-related questions of tomorrow. And here in Health and Exercise Science, we can equip them with the necessary tools.
It matters for a lot of reasons. It matters because the information is important, it matters because the problem is important, it matters because the people are important, and it matters because we need to continue to funnel bright, talented, young, motivated people to be contributors in this area.
Thanks for taking the time to explore our program. If you have additional questions, comments, concerns, you're certainly welcome to drop me an email or contact me by phone, and I'll look forward to hearing from you.